Welcome to Stillwater Chronicles. Tonight, we settle into a story about a surgeon who had already saved this patient once. There is something about an operating theater at night that feels like the inside of a held breath. The lights are different here. Not warm, not amber, not soft. They are white and absolute, the kind of light that leaves no room for shadows, that makes every surface precise and deliberate. The stainless steel gleams with a cold certainty. The monitors pulse in slow, steady green. And beneath it all, almost below hearing, the ventilator breathes its quiet, rhythmic breath, in and out and in and out. Patient is something that has never needed to hurry. That is where we find Dr. Consuelo. She stood at the scrub sink outside Theater 4, her hands moving through the ritual she had performed 10,000 times. Fingernails first, then the spaces between, then the wrists, turning slowly under the stream of warm water. She did not need to think about it. Her hands knew what to do. After 23 years, the body carries its own memory. She was 51 years old, a cardiothoracic surgeon. Her name was spoken with a particular quietness in the corridors of the teaching hospital. Not loudly, not as gossip, but with the careful weight of genuine respect. She had trained here. She had remained here. She had opened more chests than she could count, and had learned over those long years that the heart is both the most reliable and the most fragile thing a person carries. Tonight's procedure was routine. That was what the file said. Routine. She had reviewed it on Tuesday. A male patient, 53 years old, admitted for elective valve repair. Mild stenosis, stable presentation. A straightforward case, the kind she could have done in her sleep. She had scanned the name at the top of the chart, without particular attention. And then she had stopped. She had stood in the corridor, outside her office, with the chart in her hands, and read the name again. Slowly, the way you read something, when the letters are right, but the meaning is wrong. She had gone back to her office. She had unlocked the bottom drawer of her filing cabinet, the one that held her oldest records, the cases she kept for reasons she had never fully articulated, even to herself. Her fingers had moved through the folders until they found the one she needed. And there it was. The same name, written in her own handwriting, in the careful block letters she had used at the beginning of her career, when she was still writing as if permanence mattered. The same age, the same detailed anatomical note, a small, unusual configuration of the left coronary artery, something she had only ever seen once before, something rare enough that she had recorded it carefully in her case notes. The way you record a thing you expect never to see again. The patient from the old file had died on her table 22 years ago. He had been 31 years old. She had been a resident, 2 years into her training, and she had done everything correctly. She knew that now, had known it eventually. After the review, after the long, quiet months of learning to carry the weight of it, he had simply died. The heart had simply stopped, and she had stood at the sink afterward, in the same building, and scrubbed her hands until the water ran cold. She had told herself on Tuesday that it was coincidence, a shared name, a similar anatomy. The world was larger than her memory of it. She had not gone to see the patient. She had not been able to. Now she was here. Her hands were clean, The ventilator breathed its patient breath on the other side of the door. And in a moment, she would push through and take her place at the table. And she would begin. She dried her hands. The theater was quiet when she entered. Her team was already in position. The anesthesiologist, Dr. Reyes, standing at the head of the table with the steady calm of a man who had learned to make peace with uncertainty. The scrub nurse, Valentina, who had worked with Consuelo for 11 years and knew, without needing to be told, how she liked her instruments placed. The patient was draped and still, his chest exposed through the sterile field, the surgical site already prepared. Consuelo took her place. She did not look at his face. This was not unusual. Many surgeons did not look at the face. The face was not the field. The field was here, this precise bounded rectangle of skin and sterile draping. And here was where her attention belonged. She held out her hand, and Valentina placed the scalpel in it, without a word. The first incision was clean. She worked with the focused quiet she always carried into theater. Not silence exactly, but a quality of attention that made speech unnecessary. Her team moved around her with practiced ease. The monitors held their steady rhythm. The ventilator breathed. The theater lights held everything in their pale, absolute certainty. It was when she reached the pericardium that she stopped, not dramatically, not with any sound or sharp intake of breath. She simply stopped. Her hands remained still above the field. Her eyes moved slowly to what she was seeing. There was no scar tissue. In a chest that had been opened before, even decades before, there are always traces, adhesions, small folds of scar tissue where the pericardium had healed against itself. The body remembers what has been done to it. It keeps the record in fibrous, quiet layers, invisible from the outside, but unmistakable once you are inside. This chest had never been opened. She was certain of it. After 23 years, she had learned to read the interior of a chest the way some people read a face. The small accumulated history of it, the signs of what it had endured. And this tissue was untouched, pristine, as if no instrument had ever entered here, as if no hands had ever held this heart. She kept working. What else was there to do? She kept working because the patient was open and the monitors were steady and her team was watching, and there was nothing, no clinical reason, no observable fact that required her to stop. She kept working and told herself that the old file had been wrong, or her memory of it was wrong, or the first surgery had been less invasive than she recalled. She told herself these things in the back of her mind, while the front of her mind did what it had always done. Assessed, decided, moved. She found the valve. It was exactly as described in the current notes. Mild stenosis, calcification at the leaflet margins, otherwise healthy. A routine repair. She began the work. And then Dr. Reyes said her name. Quietly, the way you say a name when you want to draw attention without alarm. Consuelo. She looked up. He was looking at the monitor above the table. She followed his gaze. The ECG trace, which had been steady, unremarkable, had developed a small irregularity, nothing critical, a slight variation in the rhythm, a subtle change in the waveform. The kind of thing that could mean nothing. The kind of thing that you noted and watched. She had seen this pattern before. She had seen it exactly once before, 22 years ago, just before. The thought arrived in her chest before it arrived in her mind. A cold, specific recognition. The way a body knows things before the brain has finished reasoning toward them. She felt her own heart do something involuntary. A small, misplaced beat, as if it too remembered. She breathed. She looked at the valve in her hands, the careful, practiced placement of her instruments, the clean field, the steady work, and she made a decision. Not a dramatic one. Not one she could have explained fully, afterward, in the language of protocols and case notes, but a decision nonetheless. She adjusted. A small change, a slightly different angle of approach, a marginally different placement of the suture. Something she had never done before in quite this way, because she had never, in 23 years, had a reason to improvise on a routine valve repair. But she did it now, with the same steadiness, the same quiet hands, and she watched the monitor as she worked. The irregularity persisted for another 40 seconds, and then smoothed. The trace returned to its clean, even line. The ventilator breathed. The monitors pulsed their steady green. Dr. Reyes exhaled. She heard it, the small release of a breath he had been holding without knowing it. Valentina placed the next instrument in her hand without a word. Consuelo kept working. The repair was completed without further incident. It took another 90 minutes. 90 minutes of careful, methodical closure. Each layer returned to itself. The chest rebuilt with the same precision it had been entered. She worked without hurrying. She worked as she always worked, as if this moment were the only moment, as if there were nothing before it or after it, as if the whole of her attention could be given to exactly this. When it was done, she stepped back. She pulled off her gloves. She removed her mask. She looked at the monitor. Steady, clean, untroubled. And she stood there for a moment in the cooled air of the theater. Then she walked to the head of the table. She looked at his face. He was 53 years old. His hair was graying at the temples. His face, in the deep rest of anesthesia, was peaceful, entirely still, the way faces go when the self has temporarily vacated. She looked at him for a long moment. She looked at the small lines at the corners of his eyes, the particular angle of his jaw, the soft rise and fall of his chest beneath the draping. She did not recognize him. Of course she did not. She had only seen the other patient once, briefly, before the surgery, 22 years ago. She had been a resident. She had been learning. She had carried the weight of that case for 2 decades. But she had not carried his face. Only the name, the anatomy, the moment of failure. She looked at him for a little while longer, and then she left the theater. In the corridor, she stood at the window at the end of the hall. Mexico City stretched below her, still bright at this hour, the way cities never truly go dark, the lights blurring in the cold air into something almost soft. She rested her hand against the glass. She thought about the old file still sitting in the bottom drawer of her cabinet. She thought about the name on the chart. She thought about 22 years of a particular quiet weight that she had learned to carry without complaint. She thought about the ECG trace. She thought about the small adjustment she had made, the one that had no clinical precedent, no name in any textbook she had ever read. the one that had come from somewhere other than her training. She did not try to explain it. She had long since stopped trying to find language for the things that happened in the space between knowledge and instinct, between the body and whatever it is that moves through the body. She was a surgeon. She dealt in facts and tissues and the measurable rhythms of the heart. She did not deal in the other things. And yet, she stayed at the window for a while. The city held its lights against the dark. The hospital breathed around her. The quiet sounds of a building at night. The distant hum of machinery. The soft footsteps of a nurse somewhere behind her. Unhurried. The patient was in recovery. He would wake in the morning. He would be told the procedure had gone smoothly, which it had in the end, by whatever narrow margin separates the one outcome from the other. He would go home in a few days. He would live. She placed her palm flat against the cold glass. She thought, I have done this before. And then quietly, standing in the corridor of the hospital where she had trained and remained and spent the whole of her professional life, I have done this before. And this time it was different. She did not know what to do with that. She left it there, at the window, placed it gently against the glass, like something she was not ready to carry home. And she walked down the corridor toward the stairs, her footsteps soft on the polished floor, her hands clean, certain, still, at her sides. Behind her, Theater 4 was quiet. The monitors had been switched off. The lights had been dimmed to their overnight setting, low and amber now, softer than the surgical white, the kind of light that asks nothing of you. The table was cleared. The instruments were gone. The sterile field had been dismantled, and the room had returned to itself, empty and still and waiting. Somewhere below, in the recovery ward, a man breathed slowly in the dark. His chest rose and fell. The monitors beside him drew their clean, even lines. A nurse moved past his bed without stopping. The building held its quiet around him. He would not remember any of it. He would wake in the morning with a soreness he had been told to expect, and a vague sense of something he could not name. Not fear, not pain. Something more like the feeling of having almost missed a train. A brief, baseless certainty that something had happened while he was not watching. By afternoon, it would be gone. By the time he went home, he would have forgotten it entirely. Some things, after all, are not meant to be remembered, only carried, quietly, and for a long time, by the people who were present and steady and knew what to do with their hands. Thank you for listening to Stillwater Chronicles, where even the steadiest hands can carry something they cannot name. If this stillness stayed with you, if the hum of those monitors settled somewhere deep, then let it remain a little while longer. Some things we carry not because we understand them, but because we were the ones who were there. Rest now. The monitors will keep their quiet watch.